Hello, everyone. My name's Doug Rammel. What we're going to talk today is part of the Curb the Panic series. What can retail, CPG, and other companies and executives do to help?
Three areas that we're really intrigued by that also companies are stepping up is how do you now deal with your employees? Recognizing they're in very, very different situations. CEO of Marriott, which is struggling. They've had significant layoffs, but he and senior executives have gone to no pay. They are providing furlough and support for those. I'm on the board of a company. We just increased the wages of, which is making food products. We've increased the wages of our frontline workers, our factory workers by 50%, so that they can have a real incentive to go to work, to continue to be part of the solution here that we're going forward. The other area is communities and how companies can really step up. Sometimes it may be with specific resources, skills, capabilities, and people. Other times it may be money. And I will say in this occasion, the banks, which I think we as a society helped out last time, are stepping up this time.
I think for the big corporations, I do think there's unique partnerships they can do with hospitals. And so I guess I would say be patient in trying to get through to us, because we've made some really unique connections, people who are willing to turn their operations into scrubs. A neighborhood of ours where they've given us their parking spaces. They're obviously not being used. It was a huge morale boost to our employees that we can allow everyone to park because those spaces were donated to us from neighbor businesses. So I'd say be patient, think of areas of overlap, again, foods, products, or services, and try to make those connections with your hospitals.
Public health is one of those areas that when there's nothing happening, we think it's a terrible waste of an investment. When a crisis happens, why aren't there twice as many of these people involved? And ironically, prior to the start of this crisis, the School of Public Health at L.S.U. and Tulane University across the street are working on a special issue of what lessons we've learned from Hurricane Katrina for the American Journal of Public Health and a September symposium about this. So we have 5 websites across the state, including one by the Department of Health, that allows people to sign in, indicate what their skills are, and allow people from the Office of Public Health, the Department of Health, to tap in to pull people into it.
I just want to thank everybody for participating. I realize that everyone's busy right now, and particularly for the two of you that are on the front lines, really appreciate the work that you're doing. Know that our thoughts are with you. We're going to get through this together.
Thanks, Doug.
Thank you, Doug.
Thanks, guys.
Thanks, Alarice.
Thank you so much.